Okay, the overfilled syndrome. You got filler, it's been a while, you've kind of waited for it to go away, it hasn't. So let's talk about how you can identify if you have this overfilled syndrome look where you have that lymphatic obstruction and you're swollen and puffy, and what you can do about it both at home and in the office. So welcome to my channel. I'm a board certified dermatologist and I specialize in cosmetics. I have an office in Beverly Hills as well as Tucson. So I am dissolving filler all of the time. Don't feel bad about it. There are certainly some steps that we can take together that can help improve it. If you love all things skincare, dermatology, definitely let me know what topics you want me to talk about in the next video. You can like and subscribe and do all the things, and I'd really appreciate it. So I want to say between probably 10 years ago to about 2022 or so, filler was at its highest and people got a lot of filler done. Filler is an injectable that is typically done during cosmetic procedures to add volume and contour. It can fill shadows, it can fill lines sometimes. I think that what happened was people did too much filler and perhaps not in the right hands, or there's something called perception drift where you kind of forget what you look like. There's a few things that we know now that we didn't really talk about back then, and that's, yes, filler can migrate. It doesn't always migrate and fall or anything like that. So your cheek filler is not gonna fall down to your chin. Like, it just doesn't work like that if it's placed correctly. Really strong filler, like say bony type filler that has a high G prime that we wanna build a little bit more structure, so like the jawline or the cheeks, that's actually put on bone and it really stays put, especially if a little bit is placed, and then it metabolizes, it goes away, especially the hyaluronic acid type filler, and that's the most traditional type filler. There are some other types of filler that takes a really long time to go away, and they actually don't completely go away because they stimulate collagen, and that is Sculptra and Hyperdilute Radiesse. For this video, I'm only going to be talking about hyaluronic acid based fillers, and that's things like Allergan products such as Voluma, Volbella, Juvederm, Juvederm Ultra, Juvederm Ultra Plus. And then there's Galderma brands like Define and Refine and Lift and Contour. And then there are some MERS brands like Belotero. And then there are Revance brands that are like the RHA brand. So there's a lot of types of fillers. I carry all of these in my office. So say you go in to the office and you get the filler done. If it's done very minimally, it usually goes away, especially the first or second time, as it's supposed to, because your body is actually getting rid of that foreign material just over time. But the more you go in and maybe you dissolve and you add more, you add a different type, you add a different company, you know, so it's a different type of filler. So that one is cross-linked and the other one is not, because different companies have different filler materials, even though they're all hyaluronic acid. They, in a way, kind of like react with each other and create some type of inflammation. So it's this like repeated filler that we see that it becomes an issue where your body's not able to get rid of it because your lymphatic drainage is actually obstructed. This is not typically always a bad thing, where a little bit of filler is not going away. It's been there for years. I have filler in my mid-cheek and kind of like under eye area that's been there for years. I like how it looks. I'm kind of glad that it's not going away. But if I added more to it, where it kind of like overfills, that's where issues come in. And I kind of have kept an eye on that, and I know it's still there. But if you go with the math and maybe what your provider says, it's like, oh, it's been years, like it's gone, let me add more. And that's where issues come in. So with anything, less is more, especially when it comes to filler. When you get into more injections, more volumes, that's where you can get into the issues of it not going away, it looking puffier because your lymphatic drainage. So basically you have so much filler there and so much inflammation there. Like I said, your body's not able to get rid of that filler. Not only is it not able to get rid of that filler, it's not able to get rid of your lymphatic drainage. So the swelling. So when you wake up in the morning, you're more swollen. If you are more swollen than you used to be, that is a sign of like overfilled syndrome in a way. Your lymphatic drainage, your lymphatic fluid is kind of stagnant and it's kind of staying there. And that's how you get that doughy, puffy look. So of course, there's things that you can do at home for this, such as gua sha, cooling rollers, things like that to help it. They only do so much, and we think that if you have a little bit of an issue of swelling and otherwise everything is okay, that is an okay way to decrease that extra swelling that may be pulled in by that hyaluronic acid filler that's there, because hyaluronic acid, as we know, is also a skincare product that pulls in 1,000 times its weight in water and it plumps up. And that's what the filler inside our skin does as well. Both naturally, hyaluronic acid, as we age, it decreases, and then also the actual filler that we're injecting in, that's the synthetic type. So that is something that you just have to keep, in mind, where okay, you got a little bit of swelling in your under eye. Okay, you're like a little bit more puffy than usual. Do some of these things that really drain and help assist your lymphatic drainage. I do these things too, just because also we get older, our lymphatic drainage isn't as good as it used to be. We eat salt, we travel, we're stressed, all the things. So that's something that you can do at home, right? We come into some issues when the filler, it's been, years, or it can be immediately after if you don't like it, where the filler is not really going away, it's causing more issues. You're seeing that blue, almost like eye bag under the eye bag looking structure where your eye bag should be. And that's typically like filler that's kind of stuck there. We see it around the lips a lot where we're filling a lot, and this could be poor injection technique. And I would say it usually is, where people are using, injectors are using a really, really strong product that really shouldn't be used in the lips. I personally think like Juvederm Ultra Plus is like way too strong. Even like Juvederm Ultra can be really strong for the lips. You want to use something that's flexible, so it's able to kind of move with your lip as we're animating, as we're talking. And so this is really important. Another thing that I've seen a lot is like the type of injections that's being done. I feel like oftentimes there's just one way people are injecting, and that's just in and out, and that creates projection outwards. And they do it very deep. This is poor filler technique. They do it very deep, where it's almost like in your muscle. When it's in your muscle, it's very not likely to go away. And number two, our lips are just such an intricate part of our face, where it has tubercles which act like little pillows. And so that's why when you see the lips, or when you see like goal lips, you have like little like areas that are a little bit more full, a little bit areas that are a little bit less full. The tubercles, we have 5 of them. It's like here in the middle on the left side where the Cupid's bow is, and then 2 on the bottom kind of in the middle there. So you want those to be a little bit more full, and based on your ethnicity, there's different ratios that are usually better for your facial balance or preferred. And so sometimes it's more of a 1-to-1 ratio instead of that typical 1 to 1.3 where the bottom is a little bit bigger than the top. So for me, Asian, Hispanics, and Black skin types typically have a 1-to-1 or even a bigger top lip. I am Persian, so I kind of like a more 1-to-1, and I kind of like that look of a little bit taller top lip. So everyone's a little bit different. So what's the issue, and when do you know it's an issue? With your lips, it is when you see that shadowing, and that's that migration. So typically you can feel it, and it feels really thick, and it's usually above where that pink part of your lip is. And that typically does not go away on its own. So you can wait years, you can do all the massaging, you can do all the detox things you want, but you typically have to go in there, an injector like myself has to go in there and dissolve that filler that's kind of stagnant and staying there with an enzyme called hyaluronidase that actually dissolves that filler. So yes, it can be dissolved. Another reason to get an area dissolved is if you have nodules. Nodules can mean a few things. One, it can mean it's a biofilm where there's a little bit of maybe a bacteria that got in there, maybe the injection wasn't in a clean setting, or maybe you licked your lips, your injector didn't notice and then went in and injected, and that means bacteria got in there. So I'm always alcoholing down my patient's lips. Another thing is if one type of filler interacted with another type of filler, and that created a little bit of a whatever reaction. Another reason you can get a nodule is a poor injection technique. Maybe your injector just kind of, instead of doing like nice threads or fanning, did like little boluses. That's not really that natural, so sometimes you can get some nodules like that. And your body can react really poorly to a clump of filler, a ball of filler, versus like a little linear line of filler, you know? I would say the lips usually an issue, and then the under eye are typically an issue too. So for the under eye, same thing. If you feel like it's been a while, it's been at least a month since your last injection, that means all the swelling's gone. Really after like 2 weeks it should be gone. And you feel like there's swelling there, you're getting up and there's more swelling there. Perhaps you've gotten overfilled, perhaps it's just obstructing your lymphatic drainage, your body's not dealing with it really good. So don't be shy, go in there, you can get it dissolved. Once we dissolve the area, you have to take into consideration a few things. And this is not bad, but these are some things to know, and this is not to fear monger. Filler, I love injecting filler. I think it's such a great thing for certain patients. Again, I have it as my career, but I think that you just have to be really careful with how many you do. You have to really trust your injector if they're just pushing a whole number of syringes, especially in one sitting. That can create such an inflammatory response that your body can really just not be able to get rid of it. So I don't like to do more than like, for a full face, 4 or 5 syringes or so. I've had patients come into my office and they were like, my last injector did 12 syringes on me. Some of the cons of getting overfilled and removed is if you've been very overfilled and you want to just remove it, I wouldn't necessarily recommend that just all of a sudden, because your skin has been stretched out essentially from all this filler. So by dissolving it, you're gonna switch it, and the trade-off is wrinkles and possibly lax skin. So that's something to take into consideration. I often will bring in a lot of my skin tightening lasers for my patients. Radiofrequency microneedling helps stimulate collagen and tighten that skin, but it also helps improve and increase those lymphatic vessels that I said are all clogged up from some old filler. So it helps improve that. So that is huge. So in my protocol, if I'm dissolving, for instance, I go in, we dissolve it. I may do it 1 or 2 sessions, and then I take a look, and typically I'll do like an injection of PRF, which is your own stem cells, just to heal the area. And then we'll do 3 sessions of radiofrequency microneedling, such as Morpheus, and then I will refill. So I tell my patients this is kind of like a 6-month process. And not specifically for the under eye, but something like around the lips. I tell my patients, listen, that border has been compromised. So you may not get a really nice crisp border like you see on Instagram or that I have with my patients that have just started with me, but you gotta give it a lot of time for that skin to heal. So you can't just dissolve and then refill in 2 weeks. I actually like to dissolve and refill in like 2 or 3 months. I would rather someone go through the process and getting their filler dissolved and refilled appropriately if needed, if it wasn't like an overfilled thing. Because again, filler is good, but I think that with anything, you know, things can go wrong, or the type of filler that was injected, or your injector in general wasn't doing it correctly. So hopefully that was helpful. I know we talked about a lot. Let me know if you guys have any questions and if there's any follow-ups, and I'll be sure to look at the comment section. See you guys in the next video.